Hello, my name is Dr. Jo White. I'm clinical psychologist and advanced certified schema therapist, and I am creating a series of videos focusing on experiential exercises. And this video is focused on imagery for assessment. So one of the ways that I like to use imagery during the assessment period of schema therapy is to explore unmet needs and schemas in childhood experiences. And so that's what I'm going to be talking to you about today. If you have worries about getting started with imagery rescripting or imagery exercises, then you might find my free resource helpful, which offers a checklist for making sure that you've covered all of the bases before you do imagery rescripting. And particularly in relation to imagery for assessment, you might find the client handout, which explains imagery exercises, to be helpful. So I'll put a link in the comments for how you can access your copy of my free resource. Okay, so thinking today around using imagery to assess unmet needs and schemas in childhood experiences. So during the assessment period, I like to recreate at least a couple of memories with my clients to understand what they needed back then and how their needs weren't met. So these are with significant people within the child's life, so often the parents, but it could be grandparents, siblings, recreating as many images as you find helpful to understand the schemas that are going on for your client. And I find that I get a much richer level of information when I explore memories through imagery than when we just talk about memories. And so it might be that you've talked about some of the memories that you then go on to explore during imagery exercises, because it helps to activate the schemas and really give you a sense of the meaning of those experiences for your client. So the steps that I take, so first off, you need to explain to your client that you're going to do some imagery work. So you might use some ideas from my resource to help you with this. You want to check out any worries that they might have about doing imagery and provide them with any practical and emotional reassurance that they might need. So, for example, if they're worried about getting really overwhelmed during the imagery exercise, then you can let them know that it's okay to pause at any point that they want to, take a breather, and then you can go back into the exercise again afterwards. So checking that they feel safe enough and they're ready to use imagery for assessment. And then you want to ask your client for a significant memory of an upsetting situation with one person. So perhaps focusing first on one parent. If you know that your client has been subject to some really scary, terrifying situations when they were very unsafe when they were little, then you might want to ask them to bring a memory that's just a little bit difficult, rather than one of the really traumatic memories. And that's not to avoid those traumatic memories, but to recognize that in imagery for assessment, we're asking clients to stick with the memory for a lot longer, stick with what actually happened for a lot longer than in imagery rescripting, where we might stop the memory and do some rescripting. In assessment, we're exploring what actually happened. And so you don't want to have your client absolutely terrified or really dysregulated during imagery for assessment, because they might have to stick with it for 20 minutes. So asking for a memory that feels significant but tolerable to sit with. And so you want them to close their eyes and recreate the scene and talk you through it, describe it to you as though they're in the memory right now, talking from the first person in the present tense. And then there's some key areas that I like to explore when I'm doing imagery for assessment, to identify the unmet needs and the schemas. And so as I talk through those areas, I'm going to use an example, an example I've created to help you to understand those areas. So the first thing that I want to check out is how old the client is within the image that they've brought up. So that really helps you to understand what's developmentally appropriate for them. So in my example, Jane is 5 years old. And so we know, with a 5-year-old, we would expect a parent to be, or somebody, an adult, to be present. We would expect that they would need quite a lot of help with emotional regulation, for example, managing their time. So first off, checking out how old they are. And then secondly, I want to know what's happened. So what's triggered the situation and why was that trigger important? So in this example, Jane had been keeping herself occupied. She was alone in her bedroom as her mum would complain at her for making too much noise when she was playing. She had knocked her money box onto the floor and it had smashed open, breaking and making a big noise. Jane was really worried about both making a noise and breaking the money box, as that would upset mum. In the past, mum has shouted and then gone to bed for long periods. Jane doesn't want her mum to be upset, and she's really sad about the money box as it was something she really loved. So in this example, then I would be hypothesizing, emotional deprivation. Jane's upstairs playing by herself. And mum saying that she's too noisy when she's downstairs. So that could even point towards defectiveness. There's something bad about me when I play. And potentially subjugation as well, where Jane's worried about doing something wrong and upsetting other people. And then I'd want to find out, how is the parent managing the situation? What are they doing? What are they saying? And that will help you really get a grasp of what the unmet needs might be. So in this example, Jane's mum storms upstairs, shouting about the noise, and then sees the broken money box and says, "What have you done, you stupid girl? You're always so careless." Her mum then looks really sad and goes to her bedroom. So again, I'd be wondering about defectiveness schema with the way that Jane's mum uses quite punishing language and potentially punitiveness towards herself. And then I'd be thinking about the way in which mum's communication might be internalized, potentially a critic mode, a demanding critic mode, I have to be perfect, or a guilt-inducing critic mode, I mustn't upset other people. And then I'd want to be checking out, how's the child feeling and what are they thinking? So trying to get an understanding of any beliefs about themselves that may have developed during the memory. So Jane feels sad and worried about upsetting her mum. She wishes she hadn't been so careless. And sometimes you might get a sense of some of the coping modes that have started to develop in childhood. So potentially here, you could imagine maybe a perfectionist over controller mode developing. I've got to play so perfectly that I don't break anything. And then you want to ask your client, what do they need? Do they have a sense of what they need? And if they do have an idea about what they need, can they ask their parent for that need to be met? And how does the parent then react? Because that's often very telling about the potential schemas. So when asked what she needs, Jane says that she needs some help so that she's not so clumsy. She's too scared to ask her mum for help as she might upset her even more. So this again is suggesting a lot of emotional deprivation to me, potentially subjugation as well. I find often in cases where there's been a lot of emotional deprivation that clients will find it really hard to know what they need. And that's where they need therapists to step in. And when we're working on imagery rescripting to help them to understand the level of unmet need that they had and how it felt to be validated or to have the attunement and the care and attention that they needed. Okay, so those are the main areas that I would want to be exploring in imagery for assessment. When I've explored the image as much as I can and got as much information about it as I can, then what I like to do is to provide some imagery rescripting at the end so that I'm not leaving the child in that situation by themselves. But this all depends on how much time you've got left in your session, because you need to be leaving some time to debrief with your client. So if I've got time, then I like to do some rescripting. And so in this scenario with Jane, then I would want to be offering some physical comfort, some reassurance that it's okay to make mistakes, that everybody makes mistakes, that I can tidy up the money box, and maybe that I could even glue it together so it's fixed. I might think about whether a colleague could offer some help to mum, because Jane's kind of holding a responsibility around mum's feelings. I might also want to offer to stay and to play with her. If you have less time, then you can use the safe place exercise to go bring the client through safe place before bringing them back into the room, and that can be helpful to soothe any dysregulation that there might be. And then the final step is about debriefing with your client when you bring them back into the room and get them to open their eyes. So finding out for them, what stood out, what did they notice, how did they feel, noticing the thoughts about themselves, when you've done some rescripting, then that can often help to provide a different perspective about those memories. So maybe there's been some perspective shifts. And as a therapist, then I would want to be sharing a few of my reflections as well from the imagery exercise, what I noticed, the needs that I noticed went unmet, what I would have liked to have done to support them in that imagery. Some clients I find have a hard time kind of exploring the exercise afterwards, and maybe they need a bit of time to process, and it's something that is helpful to come back to next session, and they might spend some time making some notes after the session as they absorb the exercise. So those are the main areas that I would focus on in imagery for assessment. Again, if you'd like a free copy of my imagery resource, then I'll put the link in the comments, and I will be back again in about a month's time to do another one of these series. Okay, thanks everybody. Thanks for joining me. Bye.